At this time, we are going for the next slot, that is by Butabika National Referral, Dangers of Drugs and Substance Abuse. Now, guess what? This is going to be very, very interactive because what they are going to talk about, what they are going to present, is known by everybody. So please, feel free to ask any question. Actually, at this particular time, we just only need questions from you. And how are we going to do it? You have papers or books provided by Hotel Africana. Hotel Africana, thank you so much for this. You're going to write down your question, and then if you're done, just raise your hand. I and my colleagues are going to pick it, and we're going to put it onto the panel. They're going to answer it. But there are few who may have their questions ready for them. So you're going to do that. At this time, I don't want to preempt the panel's slot. I want to thank you and I welcome Butabika National Referral. They are going to be joined by Dr. Hafswa and Dr. Basanga, who is going to come back. Thank you so much. Dr. Mtamba? Okay. Dr. Mtamba, you're welcome. He's a very energetic man. He has to come to the panel.
Thank you, MC. All protocol observed. Good morning, ladies and gentlemen. I just walked in, so I'm still catching my breath. But I want to, first of all, recognize my boss, Dr. Hafsa. I don't know if she has already introduced herself, but she's the Assistant Commissioner in charge of Mental Health and Substance Use Division at the Ministry of Health. I also want to recognize Mr. Saidi, who is at the Ministry of Education, with whom we do a lot of work, who is in charge of counseling and guidance at the Ministry of Education. But they will talk about themselves. Dr. Mtamba is my name. I am a senior consultant psychiatrist at the National Referral Mental Hospital. That is Butabika. And I also head the alcohol and drug use program there and deputize the director. So I'm heading the team from Butabika. They will introduce themselves as we respond to your questions. I don't know how much time we have, but we know that for this session, we are mostly going to listen to you asking us about mental health, alcohol, drugs, and any related issue, so that we can respond. Dr. Basangwa, you're welcome. He's the de facto head of our team. You've already listened to him. Maybe you also have questions from his presentation. So maybe let me allow my colleagues here to introduce themselves quickly, and then the ones that I haven't introduced, and then we can now hear from you. Then we shall hand over to the moderator.
Good morning, everyone. Kenneth Yesga is my name. I'm an occupational therapist. I work with You Belong Uganda. You Belong Uganda is an NGO. We work with Butabika Hospital and the Ministry of Health. Thank you.
So, good morning, everyone. I'm called Eric Kwebiha, a therapist as well, working at Butabika Hospital. And I've been to many schools. I don't know if I've been to any of these ones where we talk about mental health and addiction. And that's why I'm here. So we'll have that discussion as we go on.
Good morning. My name is Jen Mapenzi. I'm a drug and mental health therapist in Butabika Hospital.
If your question is directed to someone, on the paper you can put his name. I guess you remember. You have very sharp memories. You're just very young leaders. So those ones who have the questions on paper, I suggest you raise your hand. I will pick them with a few friends of mine who are putting on red t-shirts or t-shirts of Drugs Apana. But I'll also give a chance to those ones who feel they want to test their courage, their confidence to stand up and speak. I will take the first slot right now.
Good morning to everyone. My name is Mwongera Tisha, the welfare minister from the mighty school, St. Balikudembe SS Chisoga. My question goes to Dr. Baswangwa David. My question goes, sir, you say that drug abuse causes infertility. So I would like you to elaborate more about that.
Okay, Dr. Basangwa, I think he has taken note of that. Infertility, we need to fill the world. So drugs, hapana. Here we get to, and that is Chisoga. You're welcome.
Yes, thanks very much for this opportunity. My name is Asaba Prince from St. Patrick's High School, right away from the Oil City. My question goes to Kwevia. I'm seeing drug abuse, but when I go in the hospital, they also tell me that you are going to get drugs. How are those drugs also abused?
Eric, that is a very good question for you. Are those drugs also abused? I want to be also side sensitive. Let's go here.
I'm having no question but an idea. Should the government stipulate a better law against drugs completely other than for the persons below the age of 18? Thank you so much.
That's an idea which we shall think about and take. Dr. Hafsa is around.
Thank you for the opportunity. My name is Nanyanjo Esther from Seke Senior Secondary School. And I'm the disciplinary minister. My question goes to Mr. Eric Kwebiha, that should we crucify all drugs because of some people who are incapable of using drugs? Because we have pharmaceutical drugs and illegal drugs. That is my question. Should we crucify all drugs because of some people who are incapable of following the instructions?
Sankubuga Simon, the head boy secondary school, the pride of Rengo. What are seizure disorders to the doctors above on the table?
Thank you. I'm taking more two questions, and I'll give the panel a chance. And then after that, we shall come for our next round. Is that fine? But I'm going to have him.
Good morning, everyone. My name is Muliwa Constantine, and I'm the Assistant General Secretary, UNSA, Kampala District. For me, I'm going to ask the question to the entire House and as well as the people amidst us or in front of us. Yes, we are talking about drug abuse, but in the struggle of us to curb down the evil of drug usage, why is it that amongst the government officials themselves, they are the people that are sneaking in, or they are the people themselves that are sneaking in these drugs? What are you going to do to curb down what are you going to do to curb down the entrance or the bringing in of the drugs before you say that we have to fight the drugs? Because it is amongst the government officials themselves that are bringing in these drugs.
Thank you. He said it's a question to the whole panel. And did I say two people? Okay, I'm going to give more two, then we can go on. Let me do it.
Thank you so much for this opportunity. A very good morning for everyone here. My name is Okelo Martin Bryan, and I serve as the disciplinary prefect Luzira SS. My question goes to our former speaker, the paper secretary. He said about putting child helpline like 116. So my question is, and he said the office is at Chireka. So assuming I've identified that thing in our side from northern there, how may they respond quickly to that since the office is stationed in the central region? Thank you so much.
Thank you. So at this time, I'm just going to request the panel to respond to that. I think I'm a person with a very big heart. I'm going to come back. Just don't worry. My heart is not so mean. Okay, so the panel, I'm going to request you to respond to these questions. Thereafter, we shall take another bunch, and we shall all be at par at the end of the day.
Talking about how infertility comes in. Before infertility, we have what we call fertility. What is fertility? Fertility is when two reproductive particles get together to form something that will eventually grow into a human being. Now, if there is anything that stops these two getting together, then you develop what we call infertility. So what these drugs do is either prevent that happening or cause a problem such that they cannot develop. For example, if we use alcohol as an example, as one of the drugs, alcohol has a tendency of reducing. We shall start with the male partners. The male partners, it will go to disorganize the formation of the spermatozoa in the testicles. So the spermatozoa cannot be formed in one large enough quantities that are required for fertility to take place. That's number one. Number two, they don't only stop at reducing the quantity, because you require a certain quantity of spermatozoa for fertilization to occur. If the numbers are so small, it will not happen. But it doesn't only reduce the numbers, it will also deform. When you look at spermatozoa of somebody who has been taking a lot of alcohol on a microscope, many of them are deformed, many of them are dead, many of them cannot swim to get to where they are supposed to meet the opposite, the ova. So what in the end will happen? If these are lazy and they can't swim to the target, then there will be no fertilization and a number of other things. Okay? Let alone the fact that when people have taken a lot of alcohol, performance is also reduced. But the same also happens the other side. When a female takes a lot of alcohol, similarly, the ova are not properly produced to come over to have the fertilization to take place. But also the hormones that are responsible for the reproductive process get reduced, and therefore that will impair proper fertilization. And that's usually the cause of the infertility, among others. But this does not only happen with alcohol. Even all the other drugs that we talked about, they have a tendency of affecting the process of fertilization in similar ways, but sometimes also in additional ways. For example, somebody taking cat has a tendency of strongly impairing the formation of the spermatozoa in the males. Okay? So seriously that, they will not have enough to support the process of fertilization. Okay.
Maybe to add on what the doctor has said, science tells us that the sperm has to run 72 hours. So a person who has been on alcohol for a very long time, and then is taking cigarettes as well and other drugs, as I have said, definitely the sperms will be very, very weak to run those miles, because it has to be strong to run those miles. So if they are weak, definitely there's nothing that will happen. So if we are looking at the dangers of why we shouldn't take substances, then I think we have to agree with what science says, as the doctor has said.
Okay. So, good morning, ladies and gentlemen. I'm sure there are no others, because others in school, they used to tell us, good morning, ladies and gentlemen, plus the others, in case you're not part of that too. But I'm sure in this group here, we should only have those two categories. Oh, by the way, it has another meaning lately. But no, I meant the other one where you're not a gentleman and you're not a lady. So there was a question around government doing better or getting better laws that are, I think, that are cutting across everyone. I didn't get the question very clearly, but I would just want to talk through that. So government, one of our role is to actually enact laws and put in place regulations, but also to enforce. And Uganda is so wonderful. We have the most beautiful laws in the region. Our only problem, or where we find difficulty, is at the level of enforcement. And who does the enforcement? The enforcement is done by me and you. And of course, the police officers and other relevant enforcement officers. But what I want to emphasize in these laws, very specific to answering what he wanted to say, was the laws are there and they cut across. And for most of them, they are protecting you people. The laws that are against substance use are protecting you, the young people. Reason is that when you start, actually the industry targets you. I've always said this, those of you who have listened to me. The industry will always target you because you have not made your decisions yet. You do not know what you're getting yourself into. You don't have enough knowledge. But also the fact that once you start early, you'll get addicted and you become their future customers. You'll be the customers of Nile breweries and BAT, that is British American Tobacco. They want you so much. So that's the reason why we make laws that protect you. I have another session, I'll talk about this in a little detail. But what I want you to do for me now is the alcohol control bill. It is in Parliament, but they are keeping quiet. Mbabirako, they told me, you wait for elections, then we shall come. But after elections, it will be, so many people will have gone. But what I want you to do, like you've done before for mental health, it may not be this group. You people can stand up and say, please, enough is enough. We want a law against alcohol. We want a law that will protect us, the young people. Who is willing to help us here? Anyone in this group? Yes, we have the capacity. You can do it. You wake up one day and say, please, you write a letter to the ministers, to the different ministers. You write to my Minister of Health. You write to the Minister of Education. You write to, even to Parliament. You can write to the Speaker and tell them enough is enough. We shall help you take these letters. You may fear. But you can even tell your headmasters to help you. We want to hear the voice of the young people. We don't want you to move on the streets because that one can be dangerous. But we want us to do it in a smart way as gentlemen. Tuliwam, is it possible? Yes, it is. I'm answering. It is possible. Young people, you've always done it. You did it for mental health. There's a time other young people marched into Parliament and told them, you people, we have a problem of mental health. So these children went, met the Speaker. They told her about it, and then she wrote to the Ministry of Education. And the Ministry of Education came up with a circular. He's going to tell us about it. That tells every school to provide a 1 hour for mental health every week. How many of us are having this 1 hour in your schools? Wonderful. I'm seeing some few hands. For those of you who are not doing it, I do not know why. These are the laws of Uganda which are protecting young people, but many times maybe they are not disseminated and we are not enforcing them. So please, let us help ourselves with the alcohol. There's an alcohol bill in Parliament, seated, doing nothing. They've kept quiet about it. And yet it can be very, very useful for us. We already have a law on drugs, and we are just developing regulations. But you can also remind us and say, you guys, when is it coming into force? Because it hasn't come into force yet. Thank you.
Okay. I think let me stretch a bit. Okay. I'm going to talk about, drug abuse in the shortest time possible. But you have to be very attentive. One, let's use these terms. One of the terms is the word illegal. If you use any illegal substance, before even its effects, but you're using any illegal substance, you are abusing. Is that clear now? That's the first thing. As long as the drug is labeled illegal and you use it, it is abuse. Is that okay? Then we go on the other side to their legal ones, because they are there. Someone talked about the medications we use to prescribe and treat illnesses and so forth. So when you go on that side, I think the most important thing is, are you using it for its intended medical purpose? That's important. On the legal side, if you're using the drug for a purpose other than that was meant for, you're abusing it. Are we there? Then the last thing is, if you're using it for its intended purpose, but you're overly using it, you're using amount that wasn't, advised by the medical people or professionals, you're also abusing it. Quickly, who has understood? Let me start with these ones here. I'll mention three major things. One, I thought you were in class. We are learning, isn't it? And teachers ask questions. Are they allowed to ask questions? Who wants to try? Quickly. Okay, use anything that is, as long as the drug is illegal, that is abuse. Next. Yes. Yes. If it is legal, meaning it's prescribed medication, sometimes we say over-the-counter medications, but if you're using it for what? Now the English there comes in. What's not supposed to be used for? Then lastly, yes?
There's a response here. There is a response here, Eric.
Okay. Where are you, by the way?
Well, using the drug overly is also illegal. And
yes, if you're using it, the dose that is beyond what it was intended for. So that's why when we are talking about, what we are doing right now, we're actually sensitizing you. Maybe another time I can say we are educating you on health matters. And that's why, the reason why I do this, because if you know how much choices you have in life, they are enormous. But sometimes we don't use them rightly. Some of the things we can't go to each person and try to regulate and control. What we are doing, we are empowering you with information, okay, that is evidence-based. We don't just think about it. We've done research. And we are saying, get to know about this so that now you make what we call informed decisions. Informed. Now that you know, what are you going to do next? Has that made sense? So we're not crucifying these medications, but we're trying to make you aware of the risks involved so that you can make appropriate choices, especially, early enough. Like doctor said, sometimes they target your young brains because your brains are still growing or developing. Hope you know that. Until the age of around, I think, 25, around there. So if your brain is still developing and subject to these drugs, you're going to have issues with how you function, whether now or later in life. Thank you.
Yes, good morning once again. There is a question here which was forwarded by you guys. And it goes, how can I help a person who uses drugs? And I would like to first get the responses from that side. Anyone who is ready?
Any response? Okay, I'll take the person near me first.
Yes.
Teach the community about effects of drugs.
Thank you. You will teach this person about the effects of drugs. Okay, that's good. Another one.
Okay, thanks so much. I think what you can do is, first of all, befriend the person and get to know why he or she is behaving in such a manner, and possibly get the way forward to curb such a problem. Thanks.
Okay.
Thank you. You're good. You put your name first.
They said how to help a person who uses drugs. I'm wondering, what if this person is your father or your mom?
Once again, my name is Mliwa Constantine, a student from Progressive SS Tindali. To answer that question, I would first of all engage this person in guidance and counseling to exactly find out what is making this person to take the drugs or engage in the practice the person is doing.
Thank you.
That's good. The last one.
Thank you for the opportunity. Exactly, I will inform the person about the disease and sensitizing him or her to follow the instructions that are given on these drugs.
Okay, thank you. What about if this person is your dad or mom or something like that?
If he or she is my relative, I will inform him or her to first go for sensitization to the doctors that are good in sensitizing, the official doctors to sensitize him or her.
Okay, thank you. The hands are very many, but because
I think
of time,
we can do with that. Time is not our best ally.
yes. In summary, all the responses are very right. Someone talked of befriending this person and talking to him, mainly using the knowledge that we have acquired today about the dangers of what? Of drugs. But by first befriending him, are we together? And then also, because I understand most of our schools, we have what we call the school counselors and the school nurses. You advise this person to go to a school what? A school counselor or a school nurse for more support. Are we together? And then if this person is at home, because the reality is that drugs are not far away from us. The drugs are within us. Are we together? And I always say, if you come from a family and there is no one who uses alcohol, drugs, then we are very lucky. That's what to show that how common these drugs are and how they are within us. And then if the person is at home, maybe it's your brother or it's your sister, again you talk to this person about the dangers of this what? Of these drugs. But again, you can advise this person to seek for help from the health center or health facility so that he can be well supported by the what? By the health professionals. Thank you.
Okay. Thank you very much for all your responses. We are curtailed by time, so we might not be able to do another round of questions. However, we've received all your questions, and during the course of the day, we should be able to respond to them. Like I said, in the afternoon, we shall go through another interactive session where we are really finding out from ourselves and you mostly, as student leaders, as our teachers who are seated right there, as the schools, how can we address this problem of drugs and other related issues. But as we summarize, there are questions which had come in earlier in the first round, and I'll respond to them because they are specific to Butabika Hospital and official doctors. I don't know how many of you go to unofficial doctors, but yes, that was a good term. Please go to official doctors. Please go seek help from the right people. If you're to help someone who uses drugs or has any other health or mental health related problem. So one question was, as a hospital, how do you handle the drug abuse victims in the tough stages? Kenneth has partly talked about it, as have other colleagues. We help you to address the problem at whatever stage you are in. You are able to walk into Butabika Hospital and any other facility and ask for help. The other one was, do you have patients that go to that place due to drugs? It's not that place. It is Butabika Hospital. I know we come here as Butabika Hospital because we are the specialist mental hospital. But like we have said, any other hospital, you can find help when you are challenged by you or any other person using drugs. And I think the other question, which speaks to what we shall talk about in the afternoon, is we as student leaders, how best can we reduce mental illnesses like depression? And those are some of the issues that we are going to discuss later on when we meet as groups and discuss how you as student leaders, as students, as the teachers in schools, as the whole school environment, as the matrons, as the administrators, what can we put in place to address this problem? Because this problem is bigger than an individual. It's bigger than you, the student leaders. it is bigger than our family. So we all need to handle it. It cannot be left to Dr. Hafsa, Mr. Saidi, Dr. Basangwa. No, all of us need to participate. But I want to thank you very much for being part of this discussion. We can spend here the whole day talking about, answering these questions, and maybe one day we shall ask Anne to organize that fora. But for now, let's compile all the other questions and we shall interact with you again. So please, thank you again for your attention. Please clap for yourselves, clap for the person near you. If you feel like clapping for us, you can also clap for us. But thank you. And I want to thank you, our fellow panelists, for the good discussions. Over to you, MC.
Thank you so much, Butabika National Referral Hospital. The delegates have really responded and have done as well. We highly thank you.